Okay, here's my room scan. I'm just using this to put my camera on. And here are my drug cards. And that's it. Hi, I'm Courtney. I'm going to be your nursing student today. I'm sanitizing my hands.
Yeah, don't trip on that.
I'm moving your shoes so that the room is clean, or I'm sliding your shoes over so that the room is clean and free of falls. I was putting hand sanitizer. I would wear gloves if I needed to, but I'm just administering meds, so that is not required today. Can you please verify your name and date of birth for me?
Yeah. Joseph Smith, 10/05/1954.
All right, awesome. And do you have any allergies?
Yes, sulfa and betadine.
Okay, sounds good. So today, just let me check my provider orders. Today, I'm just administering some meds for you. I took a look at all the records, and most of your other meds, your levels are too high, so we're not holding those, or so we will be holding those. Your digoxin's too high, and your sodium and potassium levels are also too high. So we are only going to be giving a pain med today. So can you rate your pain on a scale of 1 to 10 for me?
4.
4? Okay. And are you able to take pills orally?
Yes.
Do you have a preferred way of taking your meds, like with water?
Water's okay.
Water's okay? All right. So I will be right back with your meds. There's my drug cart, or my med cart. My drug cards. So, as I already stated, all of her other pain levels were too high. Her digoxin was too high, and potassium and sodium were too high. So then it would just come down to codeine or oxycodone, which I think I'm just gonna go ahead and give the oxycodone. She said that her pain was on a 4 on a scale of 1 to 10. So I'm going to check the MAR, get the med away from last practice. So according to the MAR, Joseph does have an order for oxycodone. 1 tablet every 4 hours as needed for pain on a scale of 1 to 4, or a Percocet 2 tablets every 4 hours for pain on a scale of 5 to 10. But her pain was a 4, so we're only going to give her 1 tablet today of the oxycodone. So some of the nursing considerations for oxycodone are to assess pain, monitor input and output, monitor for allergic reactions such as a rash or urticaria, and to monitor for bowel status. One of the black box warnings are to monitor for respiratory dysfunction and substance abuse, and there is a risk of accidental exposure if pregnant or breastfeeding, which my patient is not. So it is safe to give this med as long as we monitor for those things. So let me grab out my med. We have a Percocet for Joseph Smith, so that is the right patient and the right med. The correct dose, which is 5 milligrams of oxycodone and 325 milligrams of acetaminophen. The expiration date is July of 2015, which for the purpose of this video, the year is 2014 because this is just a practice med. So the expiration date would be okay. And it is to be taken orally for Joseph Smith every 4 hours as needed. The packaging is okay. There's nothing wrong with it. It's not broken or anything. So I'm going to go ahead and put that in my med cup. So I'm gonna grab her water, and now we'll do our second check. This is a Percocet, right med, for Joseph Smith, right person, to be taken orally every 4 hours as needed for pain. The packaging is in good integrity, and the expiration date is July of 2015. It's to be taken orally, 5 milligrams of oxycodone and 325 milligrams of acetaminophen. So I'm going to bring my MAR, my drug card, my med, and my water over to my patient. Okay. Hi, I'm Courtney. I'm going to be your nursing student. I did provide for privacy earlier, but I'm just going to double check that our privacy is in place because we do have a mannequin resting next door. Just sanitizing my hands again. Can you please verify your name and date of birth for me?
Yeah. Joseph Smith. 10/05/1954.
Okay, sounds good. I'm going to now scan your wristband and scan the med to make sure that's okay to take. So today for you, I have a Percocet, which is 5 milligrams of oxycodone and 325 milligrams of acetaminophen. Oxycodone is used for pain. Some of the side effects are drowsiness, dizziness, confusion, headache, sedation, euphoria, nausea, vomiting, anorexia, constipation, cramps, and a rash. So can you just verify me that you understand why you're taking this med? Do you know what it's taken for?
I am taking it for pain and side effects for the vomiting and nausea.
Okay, sounds good. And you all are able to take this med orally?
Yep.
All right, so before I give you my med, I'm going to do my third check. I'm going to open up the med in front of you. This is a Percocet. Let me get my MAR back out. This is a Percocet for Joseph Smith, 5 milligrams of oxycodone and 325 milligrams of acetaminophen. The packaging is intact, and the expiration date is July of 2015. So I'm going to open the med in front of my patient and put it in the cup. So she's her med and her water. This med is to be taken orally every 4 hours as needed for pain. She's not taken a med in over 4 hours, so once again, it is an okay time to give the med. I didn't verbalize that it would be taken every 4 hours as needed for pain in my other 2 checks, but I'm verbalizing now that she has not had any other meds in over 4 hours, so it is perfectly okay to take it now. To be taken orally. Right med, right patient or right med, right dose for Joseph Smith, right person, right time, and you're taking it orally. Packaging was intact until I opened it to put the med in the cup. All right. And you said you preferred to take it with water, so that is what I have here. So I did scan your wristband. So before I give you the med, any side effects that are going to appear should show up within 30 minutes. So I will stop back in 30 minutes to monitor for those side effects. And if you feel any of that even before those 30 minutes are up, you make sure that you call for me right away, okay?
Okay.
All right, there's your med. And there's your water.
Thank you.
Yep, not a problem. So I will come back again in 30 minutes to make sure that you didn't have any severe side effects. I'm going to wash my hands again. The 5 moments of hand hygiene are before contact with the resident.
You're not in the camera.
I'm not in the camera. Are before contact with the patient, after contact with the patient, before a clean procedure, after contact with the patient's belongings, and after coming in contact with bodily fluids. So before I leave, is there anything else that you need? I do have time.
No, I'm good.
All right, sounds good. So I'm going to make sure that your bed is low and locked. Side rails are secured. The room is clean and free of falls because I moved your shoes earlier. Your call light is in place. Can you reach your call light okay?
Yep.
All right, and are you in a comfortable position?
Yeah.
All right, sounds good. And I will move the table so that it is within reach. Can you reach that okay?
Yeah.
All right, that's perfect. The table is right there. I will come back in a half hour and monitor for those side effects, and I will make sure that I document all my findings in OneNote and submit to Schoology. I will report any abnormalities according to agency policy. Let me just take a minute to make sure that I remembered everything else. I think that we are okay. Thank you. I will stop back in a half hour.